Whether you're ready to hold your little baby or you're past your due date and you want to avoid a medical induction, I'm going to be sharing with you some of my favorite tips and tricks on how to induce labor naturally that I like to share with some of my woman mamas. My name is Christian. I'm a certified birth doula, aromatherapist, herbalist, and founder of Wombman Doula Care here in Orange County, California. If you want to learn about all things pregnancy, birth, herbs, and aromatherapy, go ahead and click that subscribe button and hit the little notification bell to be notified of all my newest videos. Now, I do have to say beforehand that these tips are based on my experience of being a birth doula, and that you should always consult with your doctor beforehand just to get the okay. Now, my first tip is going to be aromatherapy. Aromatherapy is the holistic practice of using essential oils, which is a highly concentrated form of plant matter to help promote your health and well-being. Aromatherapy has been around for centuries, and when used correctly, can be very beneficial. A few of my favorite essential oils to use is going to be Jasminum grandiflorum, also known as Jasmine. That essential oil is really going to help stimulate contractions inside of your uterus. Another essential oil that I like to use is called Salvia sclarea, which is also known as Clary Sage. That's really going to help intensify your contractions, making them more effective. And lastly, Camphora myrrh, which is also known as Myrrh. Myrrh essential oil is going to really help open your cervix and encourage dilation. I like to use these essential oils dermally, but please be aware that 1% dilution is the maximum recommended for pregnant women. My next tip is acupressure or acupuncture. Acupuncture is the century-old practice of using thin pen needles in specific pressure points on your body to help uterine contractions. And acupressure, just like it sounds, uses pressure in those specific points to really help nudge baby into action, kickstarting labor. Now, there are two pressure points. The first is going to be in between the thumb and your index finger in the webbing right there. And the second is going to be on your leg, about 4 finger widths above your ankle. And you can supercharge this option by using the essential oils I mentioned previously, and that can really help get things going. My next tip is nipple stimulation. Massaging or twisting your nipples a few times a day, but not to the point of pain, can actually help with the production of oxytocin, which is a natural hormone that you make in your body to help uterine contractions. My next tip is affirmation and meditations. A large part of labor is mental. So wherever your mind is, your body is going to follow. An example of some affirmations will be, my body is made for this moment. My baby and I are working together. My baby and I are working together. And each contraction is getting me closer and closer to my baby. If you're finding this video helpful, go ahead and give me a thumbs up and hit the notification bell to be notified of my newest drops. And keep watching. I'm going to give you the topic for my next video. I feel like you're really going to like it. My next tip is getting active. With this simple active movement, you're allowing gravity to come in and help bring baby's head down. That pressure on your cervix can really help kickstart labor, especially if you've already been feeling contractions. Doing the stairs, squats, lower body stretches is really going to help the blood circulation in your pelvic area. My next tip is castor oil. Castor oil has been passed down for generations and has really been used because it can help stimulate bowel movements. By causing intestinal spasms, it can in turn irritate your uterus, kickstarting it to contract. My next tip is herbs. Using herbs like red raspberry leaf is really going to help nourish and tone your uterus and really just help with the overall health of it. My next tip is sexual stimulation. Having an orgasm contracts your uterus, and sperm also contains prostaglandins, the hormone that thins and dilates your cervix, ripening it for delivery. Now that we've got your body all nice and ready for labor, stay tuned for my next video where I'm going to show you how to successfully cope with surges unmedicated. Thank you for watching. If you have any questions, go ahead and comment below. I would love to answer your questions. And stay tuned for my next video.